Hello. This video will show you how to prepare your fistula for dialysis. A nurse will be available to help you with this, as you may need an extra pair of hands. Wash your hands as well as your arm and fistula site thoroughly with soap and water. This reduces the risk of infection. Before you begin dialysis, you need to ensure that your fistula is safe to use. This means that it is working and that it does not show any signs of infection. Look carefully at your fistula. Check that you can feel the buzz of the pulsing blood flow and that it is not hotter than normal. Check that it is not red or swollen, that the skin is not broken, and that there is no discharge. If you notice any of these changes, there may be an infection and you should speak to your dialysis nurse. Once you're happy that your fistula is okay, you need to choose the best place to insert the dialysis needles. This is called needling. You need to choose two sites, one where the blood will be taken away to the dialysis machine, and the second where the dialysed blood will be returned. You will have discussed your personal approach to needling with your nurse. Some people use the buttonhole technique, where they insert a needle into the same place every time. Over time, needling becomes less painful as a tract forms. Other people use the rope ladder technique, where they choose different insertion sites at each dialysis session, working their way up the rungs on an imaginary ladder. Use the skin cleansing system your local unit recommends to clean the sites that you have chosen for dialysis. In this example, we are using chlorhexidine skin cleansing wipes. Clean with a single swipe and use a second wipe for the other needle site. Wait for the sites to dry. Some people choose to inject a local anaesthetic into the skin or apply a numbing cream prior to inserting the dialysis needles. If you do use local anaesthetic, insert the needle containing local anaesthetic into the skin over your chosen insertion site. The needle should go just below the skin but not into your fistula. Inject about 1 to 2 millimeters of the local anaesthetic to numb the area. Repeat this procedure at the second needle site. You can check that you have adequately numbed the needle sites by using the tip of the fistula needle to touch the skin. You are now ready to needle your fistula. Take the fistula needle and insert it fully into the lower of the chosen sites. Slowly pull back the plunger on the syringe so that the fistula needle and the entire syringe fills with blood. Once the syringe is full, slowly push the plunger to return all of the blood back into the fistula. The blood should flow back in easily and not cause you any pain. If the blood does not flow easily, it means that the needle is not positioned correctly. You should readjust the needle and repeat the process until the blood flows smoothly into the fistula. You may need to turn the needle to achieve this. If it is painful and the area starts to swell, it means you have pierced the opposite vein wall. You should remove the needle and start again, seeking help if required. Once you're happy with the position of the needle, secure the needle wings as you've been taught and clamp the line. It is very important that the needles are secured so that they do not become dislodged during dialysis and cause damage. At this point, you may need to flush the needle with saline to keep the line clear. Your nurse can help with this. Repeat this procedure with the second, higher insertion site. Dispose of all needles into the sharps bin. All other waste can go into the clinical waste bin. You are now ready to connect to the dialysis machine.